Hello everybody, welcome to my channel. This is a pathology video on respiratory pathology. This is the second in the series of videos on emphysema. The topic is classification and pathomechanism of emphysema. This is by Dr. C.S.B.R. Prasad, Professor of Pathology, Sri Devraj Aras Medical College.
And classification of emphysema, depending upon the type of involvement of the acini, it is classified into centriacinar, where only center portion of the acini is associated with the dilated air spaces. Panacinar, every part of the acini is showing dilated air spaces. Paraseptal, only periphery of the lobule is showing the dilated air spaces, and mixed or unclassified may have irregular involvement of the lung lobule in this process. And again, to recollect the components of acinus. Acinus is the functional unit of the lung. It is comprising of respiratory bronchiole, alveolar ducts, alveolar sacs. And again, this lung lobule can be very well appreciated on the surface of the lung, or cut surface of the lung also will show the clear cut demarcation, and each lung lobule comprises 10 to 30 acinar units. So normal acini, you can see that terminal bronchiole and respiratory bronchiole, alveolar ducts, alveolar sacs, and they are, depending upon the site of involvement, they are classified differently. So if the respiratory bronchioles are involved, it is the dilatation is mainly located at the center of the acini, or what you call that lung lobule, whereas if the terminal portions of the acinus is involved, that is alveolar ducts, alveolar sacs, then you will see the location of this dilated air spaces mainly at the periphery. And panacinar emphysema involves almost everything, that is respiratory bronchiole, alveolar ducts, alveolus. So entire acinus is involved in this process, and the lung lobule will show all dilated structures involving the entire lobule. So the same thing, the normal lung with different respiratory bronchiole, alveolar ducts, alveolar sacs, and you can see that centriacinar involving only respiratory bronchiole, and panacinar involving respiratory bronchiole, alveolar duct, and alveolar sacs. Gross cut surfaces can be appreciated in the bottom. You can appreciate the lung lobule with a septum, and this lung lobule in the center is showing dilated air spaces exactly at the center, and it is centrilobular. And if it is panacinar, every part of the lobule is showing the dilatation, so it is panacinar variety of emphysema. And centriacinar emphysema, what is very important to remember with centriacinar emphysema is its association with smoking, and it is associated with exposure to carbon dust. So the person who works in coal mines may get centriacinar type of emphysema, and those fellows who smoke chronically may also land in centriacinar type of emphysema. And the lung cut surface in centriacinar emphysema, you can appreciate the lobule with white demarcation, and look at the lobular center of the lobule. The air spaces are dilated here, and the color of the air spaces, dilated air space also is black. It is due to deposition of carbon particles, which may be seen in smoking or coal work pneumoconiosis. And this is a common appearance of centriacinar variety of emphysema. And again, closer look at centriacinar emphysema. Lung lobule can be appreciated with the white demarcated lines, and center of the lung lobule is showing the dilated air spaces. Panacinar emphysema, whole acinus is uniformly involved, and the association you should not forget with this is alpha-1 antitrypsin deficiency. So they are they may land in what is known as panacinar variety of emphysema. Now, as a corollary, just can you recollect what are the diseases that are caused by alpha-1 antitrypsin deficiency? So apart from emphysema, the cirrhosis and pancreatitis are also known to be associated with alpha-1 antitrypsin deficiency. And this is a case of panacinar emphysema. Entire lobule is having uniformly enlarged air spaces. and paraseptal emphysema or distal acinar emphysema, wherein the dilatations are towards the periphery of the acinus, and this is most commonly associated with what is known as lung fibrosis. So anything that causes lung fibrosis may be associated with this type of paraseptal variety of emphysema. On the right side you can see that lung globule, and at the periphery of the lung globule you may see you are seeing dilated air spaces. Compare with that of centriacinar, wherein center portions of the acinus is dilated, showing dilated air spaces. Mixed, or these are most common and least significance, there may be mixture of irregular dilatation of air passages is seen in these persons. And looking at the histology of lung involved in this emphysematous process, on the left side is a normal lung. You can see lot of substance, parenchyma, whereas on the right side there is a little parenchyma with lot of air, and you can see that free floating alveolar septa into the lumen. So this is very typically seen in the case of emphysema because of destruction of alveolar septa. Again, high power to show that free floating alveolar septa into the air spaces. And coming to the pathogenesis, there are two theories. One is protease anti-protease theory and oxidant antioxidant imbalance. So what is this protease anti-protease theory? So in the case of smoking, the person smokes, which this smoke contains lot of chemicals which are irritating and to the air passages, and they recruit inflammatory cells mainly in the form of neutrophils, and these neutrophils phagocytose these air particles, and as a reaction it liberates lots of enzymes which are responsible for destruction of alveolar septa. This slide shows that the neutrophils are releasing some of the enzymes, especially the elastases, which are responsible for destruction of the alveolar wall elastic fibers, okay, which is the basic pathology that ultimately goes into emphysema. And we have some natural defense mechanisms, mainly in the form of an alpha-1 antitrypsin. So this alpha-1 antitrypsin can neutralize many of the enzymes, including elastases. So any genetic deficiency that is associated with mutation of alpha-1 antitrypsin or decreased synthesis of alpha-1 antitrypsin may result in increased destruction of the alveolar elastases, elastic fibers. Okay, and sometimes these stimulated neutrophils or macrophages, by ingesting these chemicals that are present in the smoke, may release what is known as superoxides, especially superoxide and hydrogen peroxide, and this superoxide, hydrogen peroxide are responsible for destruction of varieties of cells and tissue, and this is usually neutralized or subdued by superoxide dismutases, which are naturally occurring, or antioxidants which are naturally occurring. So any person who has got decreased variety of naturally occurring antioxidant mechanisms may be associated with increased destruction of alveolar septa. So the alpha-1 antitrypsin, which is responsible for elastase neutralization, and when it is mutated, the person develops emphysema, and those persons who smoke are associated with the release of superoxides, which are naturally neutralized by some neutralizing mechanisms. If the neutralizing mechanism is inefficient, then it may result again in the destruction of the elastic fibers in the alveolar septa. A word about the alpha-1 antitrypsin deficiency. This alpha-1 antitrypsin is naturally occurring glycoprotein. It is synthesized by the liver and macrophages, and it can inhibit not only elastase, it can inhibit trypsin, thrombin and plasmin, and it is the gene is located on chromosome number 14. Normal allele is known as MM, deficient or inefficient alpha-1 antitrypsin is ZZ. And to summarize the pathophysiology, destruction of elastic fibers is the basis for emphysema, and this results in loss of elastic recoiling capacity of the lung, and so the collapse of the lung occurs when the person is expiring, and so it is obstruction to the airflow. And coming to the destruction of alveolar septa, reduced surface area for gas exchange, and the patient suffers from hypoxia. So expiratory defect and the hypoxia are the two main main features of this emphysema.
Thanks for watching. Please subscribe by clicking the button subscribe.